Gentlemen, let me ask you something direct. Have you been told that erectile dysfunction after 60 is just part of getting older? That you need pills, pumps, or injections to have any hope of firm erections again? I'm here to tell you that advice may be keeping you stuck. The truth is, there's a specific spot on your body that, when massaged correctly for just 2 minutes before bed, can restore blood flow to your penis and bring back the kind of firm, reliable erections you thought were gone forever. This isn't some miracle cure or dangerous supplement. This is anatomy. This is physiology. And by the end of this video, you'll know exactly where this spot is, how to massage it properly, and why it works even if you've struggled with weak erections for years. In fact, some of my patients have reported morning erections returning within just 3 weeks of doing this simple technique every night. Now, I want you to have value right away, not at the end. So let me tell you exactly where this spot is located. It's called the perineum, and it sits between your scrotum and your anus. Most men have no idea this area even matters for sexual function, but here's what almost no one tells you. The perineum sits directly above a critical bundle of nerves and blood vessels that feed into your penis. When you apply gentle, rhythmic pressure to this spot, you're essentially massaging the root of your erectile tissue, the corpus cavernosum, from the outside. You're stimulating blood flow, waking up dormant nerve pathways, and encouraging your body to send fresh, oxygenated blood exactly where you need it most. This technique has been used in traditional Chinese medicine for centuries, and modern urology is finally catching up to why it works so well. Before I continue, let me quickly explain why you should listen to me. My name is Dr. Emily Carter. I've spent over 25 years specializing in men's health and urology. I may not be a man myself, but I've listened to thousands of men in their 60s, 70s, and beyond tell me about their frustrations, their embarrassment, and their desperation to feel like themselves again. I've studied the anatomy of erectile function inside and out. I've reviewed hundreds of research papers on circulation, nerve health, and natural methods for restoring sexual function. And I've seen firsthand what works and what doesn't. So when I tell you that this perineal massage technique can make a real difference, I'm not guessing. I'm speaking from clinical experience and scientific understanding. Now, here's where most men get it wrong. They assume that erectile dysfunction is purely a blood flow problem, and while circulation is absolutely critical, it's not the whole story. Your penis doesn't just need blood, it needs nerve signals. It needs hormonal support. It needs healthy tissue that can expand and hold blood under pressure. When you massage the perineum correctly, you're addressing multiple aspects of erectile function at once. You're improving local blood flow, yes, but you're also stimulating the pudendal nerve, which is the primary nerve responsible for sensation and function in your penis. You're encouraging lymphatic drainage, which reduces inflammation in the pelvic area. And you're activating pressure points that traditional medicine has linked to sexual vitality for thousands of years. Let me share a story. A gentleman I'll call Richard came to me at 68. He told me he hadn't had a firm erection in over 4 years. He had tried the pills, but they gave him headaches and made him feel dizzy. He felt like his manhood was slipping away, and his wife had stopped initiating intimacy because she didn't want to make him feel worse about it. Richard was frustrated, embarrassed, and honestly, he was losing hope. So I taught him this perineal massage technique. I gave him a simple protocol. Every night before bed, sit comfortably, locate the perineum, and apply gentle, circular pressure for 2 minutes. I told him to be consistent and patient. Within 3 weeks, Richard came back to me with tears in his eyes. He said, "Doc, I woke up with an erection for the first time in years. I thought I was dreaming." Not only were his morning erections returning, but he was able to achieve firmness during intimacy again. His wife noticed the change in his confidence, and their relationship transformed. That's the kind of turnaround I see regularly when men commit to this simple practice. Before we go further, if you're finding this information helpful, do me a favor. hit that subscribe button right now and turn on the notification bell. I release videos like this regularly with science-backed strategies specifically designed for men over 60, and make sure you comment below and let me know where you're watching from. I love hearing from viewers all around the world. Now, let's continue. So why does this massage work so well? Let me explain the anatomy in simple terms. Think of your penis like a garden hose. For water to flow through that hose, you need pressure at the source and a clear pathway. Your heart provides the pressure by pumping blood, and your arteries provide the pathway. But here's the problem. As you age, those arteries can become narrowed by plaque buildup, inflammation, and reduced elasticity. At the same time, the nerves that signal your brain to send blood to your penis can become less responsive due to poor circulation, diabetes, or simply years of wear and tear. The perineum sits at the intersection of these systems. When you massage it, you're essentially priming the pump. You're encouraging your body to send more blood to the pelvic region, and you're waking up those nerve pathways that may have gone quiet. From a urological perspective, the penis contains delicate erectile tissue called the corpus cavernosum. This tissue is like a sponge. When you're aroused, blood fills the sponge, and the pressure creates an erection. But if blood flow is sluggish or nerve signals are weak, that sponge doesn't fill properly. You end up with soft, unreliable erections or no erections at all. The perineal massage directly targets the root of this erectile tissue. By applying pressure to the perineum, you're massaging the internal structures of your penis from the outside. You're encouraging blood to flow into those chambers, and you're training your body to respond more effectively to arousal signals. Now, you may be wondering why at night. Isn't this something you could do any time? That's what many people assume, but here's the truth. Nighttime is when your body does its deepest repair work. Your testosterone levels peak during sleep. Your growth hormone is released. Your nervous system shifts into a restorative mode. When you perform this massage before bed, you're setting your body up for optimal recovery and regeneration in the pelvic region. Many of my patients report waking up with morning erections after just a few weeks of consistent nighttime massage, and that's not a coincidence. Morning erections are a sign that your body is producing enough testosterone and that your blood flow is strong enough to fill the erectile tissue spontaneously. If you haven't had a morning erection in years, this technique can bring them back. But here's where it gets even more interesting. The perineum is also connected to your prostate gland. The prostate sits just above the perineum, and as men age, it tends to enlarge. An enlarged prostate can press on the urethra, causing urinary problems, but it can also affect blood flow and nerve function in the pelvic area. When you massage the perineum, you're indirectly massaging the prostate as well. You're encouraging better circulation to the gland, reducing inflammation, and promoting healthier function. Some of my patients have reported not only better erections, but also fewer nighttime bathroom trips after incorporating this massage into their routine. Now, let me walk you through the exact technique because doing this correctly is critical. First, find a comfortable position. You can sit on the edge of your bed, lie on your back with your knees bent, or even stand with one leg elevated. The goal is to have easy access to the perineum without straining. Next, locate the spot. Place your fingers between your scrotum and anus. You'll feel a slight indentation or soft area. That's your perineum. Press gently until you feel a firm structure underneath. That's the root of your erectile tissue. Now, apply firm but gentle pressure. You're not trying to hurt yourself. You're looking for a sensation that feels like a deep, satisfying pressure, almost like pressing on a sore muscle. Use your index and middle fingers and make small, circular motions. Massage in one direction for about 30 seconds, then reverse and massage in the other direction for another 30 seconds. Continue this for a total of 2 minutes. You can do this through your clothing if you prefer, but direct skin contact often feels more effective. Let me share another story. A gentleman I'll call William came to me at 72. He had been dealing with erectile dysfunction for nearly a decade. He told me he felt like his body had betrayed him. He had tried everything from pills to pumps to expensive supplements, but nothing gave him lasting results. His doctor had told him it was just part of aging and that he should accept it. But William wasn't ready to give up. So I taught him this perineal massage technique along with a few other lifestyle adjustments. I gave him the same protocol: 2 minutes every night before bed, firm circular pressure, and patience. Within 6 weeks, William came back to me with a completely different energy. He said, "Doc, I didn't believe you at first, but I'm a believer now." Not only was he experiencing firm erections again, but his confidence had returned. His wife told me privately that she felt like she had her husband back. That's the power of addressing the root cause instead of just masking symptoms with pills. Now, I need to warn you about something important. There are 3 common mistakes men make when trying this technique, and if you're making any of these, you might be sabotaging your results. The first mistake is pressing too hard. Some men think that more pressure equals better results, but that's not true. If you press too hard, you can actually bruise the tissue or cause discomfort that makes you want to stop altogether. The goal is firm, steady pressure, not aggressive force. The second mistake is inconsistency. This isn't a one-time fix. You need to do this every single night for at least 3 to 4 weeks before you'll start seeing noticeable results. Your body needs time to respond, to rebuild circulation, and to strengthen those nerve pathways. If you do it sporadically, you won't get the benefits. The third mistake is ignoring the rest of your health. This massage is powerful, but it's not magic. If you're smoking, drinking heavily, eating processed foods every day, and sitting on the couch for hours, this technique alone won't overcome all of that. You need to support your body with good nutrition, regular movement, and healthy habits. Here's something quotable you'll want to remember. Weak erections are not a sign of old age. They're a sign of poor circulation, weak nerve signals, and a body that needs support. Your age does not define your vitality. Your choices do. And tonight, with this simple 2-minute massage, you have the chance to make a choice that can transform your confidence, your intimacy, and your sense of manhood. Now, let's address a concern some of you may have. Can this technique really work if I've been struggling for years? It's a fair question. The truth is, yes, it can. I've seen men in their late 70s and even early 80s restore function using this method. The key is consistency and patience. Your body has an incredible ability to heal and adapt, even after years of decline. The perineal massage works because it targets the root structures of erectile function. It doesn't matter if you've been struggling for 2 years or 20 years. If you commit to this practice, you give your body the best chance to respond. Another concern I hear often is about safety. Is this technique safe for men with prostate issues or heart conditions? In general, yes, this massage is safe for most men. However, if you have an active prostate infection, severe hemorrhoids, or recent surgery in the pelvic area, you should check with your doctor before starting. For men with heart conditions, this technique is actually beneficial because it improves circulation without putting strain on your cardiovascular system. But as always, if you have any concerns, consult with your healthcare provider first. Let me share one more story. A gentleman I'll call George came to me at 74. He told me he had given up on intimacy entirely. His wife had passed away a few years earlier, and he had started dating again, but his erectile dysfunction made him feel embarrassed and inadequate. He said, "Doc, I feel like half a man." That broke my heart because I knew he didn't have to feel that way. So I taught him this perineal massage technique, and I also encouraged him to focus on his overall health. I told him to walk every day, eat more vegetables, and stay hydrated. Within 2 months, George came back to me with a smile on his face. He said, "I'm back, Doc. I'm really back." He had started a new relationship, and he felt confident again. His erections weren't perfect every time, but they were strong enough for intimacy, and that made all the difference in his quality of life. That's at 74 years old. If George can do it, so can you. Now, let me walk you through a complete protocol so you know exactly what to do starting tonight. I call this the Restore Method. Step 1. With your evening routine, find a quiet, comfortable space where you won't be interrupted. This could be your bedroom, bathroom, or anywhere you feel relaxed. Step 2. Sit or lie in a comfortable position that gives you easy access to your perineum. Step 3. Locate the perineum by placing your fingers between your scrotum and anus. Press gently until you feel the firm structure underneath. Step 4. Apply firm but gentle pressure using your index and middle fingers. Make small, circular motions in one direction for 30 seconds, then reverse for another 30 seconds. Continue for a total of 2 minutes. Step 5. After the massage, take a few deep breaths and relax. Allow your body to absorb the benefits. Step 6. Do this every single night for at least 4 weeks. Consistency is the key to seeing results. Simple, precise, effective. If you do this consistently, you may notice subtle changes within the first week. Better sleep, a sense of warmth or tingling in the pelvic area. By weeks 3 to 6, most men start experiencing real physical changes. Morning erections returning, firmer erections during intimacy, increased sensation, and by 2 to 3 months, many of my patients report a complete transformation in their sexual confidence and function. If you're still with me at this point, you're serious about your health, and I respect that. Make sure you've hit that subscribe button because I don't want you to miss my next video where I'll reveal 3 so-called heart-healthy foods that actually lower testosterone and sabotage your erections. When you see that list, you'll understand why so many men stay stuck. Now, let's continue. Imagine waking up tomorrow. Not just sleeping through the night, but waking up with a firm erection for the first time in years. Imagine feeling that surge of confidence when you're with your partner, knowing that your body will respond the way you want it to. Imagine reclaiming that part of yourself that you thought was gone forever. That future isn't far away. For many men, it's just 2 minutes of focused effort away. And the best part? You don't need pills. You don't need expensive treatments. You just need your own 2 hands and the commitment to take action. Here's my invitation. If this message spoke to you, if you want real science-backed methods that are designed specifically for men over 60, then subscribe right now. Hit that button and turn on notifications because you don't want to miss what's coming next. And I want you to look forward, because in my next video, I'm going to expose 3 foods you've been told are good for your heart, but may actually be destroying your testosterone and keeping you from firm erections. When you see that list, you'll understand why so many men stay stuck and how avoiding them can unleash your vitality even further. Now, let me make a challenge for you. Try this perineal massage technique for just 4 weeks. Every single night, 2 minutes before bed. Then come back to this video and comment below. Tell me if you're experiencing morning erections again. Tell me if your firmness has improved. I want to hear your results, and I guarantee other men will be encouraged when they read your story too. Comment below and let me know where you're watching from. Have you experienced weak erections? Let me know in the comments. What questions do you have? I read every comment. Let's recap one more time because repetition helps this stick. The perineum is located between your scrotum and anus. When you massage it for 2 minutes every night, you stimulate blood flow to the root of your erectile tissue, wake up dormant nerve pathways, and encourage your body to restore firm, reliable erections. You need to use firm but gentle pressure, make circular motions, and be consistent for at least 4 weeks. Avoid pressing too hard, stay consistent, and support your body with healthy habits. Put these together, and you've got a simple, natural strategy that can help you reclaim your sexual confidence and vitality. And here's something I want you to think about tonight. What if you didn't have to feel embarrassed anymore? What if you could wake up tomorrow with the kind of firmness you had decades ago? That future isn't a fantasy. For many men, it's just 2 minutes of focused effort away. I know how discouraging it feels to think you've lost this part of yourself. I've heard the embarrassment in men's voices. I've seen the frustration in their eyes, but I've also seen the joy when they realize it's not over, when they rediscover the part of themselves they thought was gone forever. That joy is waiting for you too if you take the first step. Remember this: your age does not define your vitality. Your choices do. And tonight, with this simple perineal massage, you have the chance to make a choice that can transform your health, your confidence, and your manhood. I'm Dr. Emily Carter, and I'll see you in the next video.